Definition of vitamin K. The term vitamin K refers to a group of chemically similar fat-soluble compounds called naptoquinones. Vitamin K consists of vitamin K1, vitamin K2, and vitamin K3.
Now, let's talk about how vitamin K works in our bodies. First, vitamin K aids in bone formation and maintenance. It also facilitates blood clotting. Next, consider vitamin K's role in blood clotting in more detail. 4 of the 13 proteins that vitamin K contributes to the production of are necessary for blood clotting, which stops wounds from bleeding continually so they can heal. Patients who are taking anticoagulant, also known as blood thinners, are frequently advised to use it to prevent the formation of blood clots in their legs, heart, or lungs.
Next is metabolism of vitamin K. Vitamin K is rapidly metabolized by liver and excreted through feces. Vitamin K is absorbed into small intestine and incorporated in chylomicrons. It will then enter the lymphatic system and is transported throughout the body. Some vitamin K are stored, some is oxidized, and some is resecreted with very low density lipoprotein or VLDL, which only 30 to 40% of vitamin K are stored in our body. Vitamin K is also mainly focused and important for blood clotting. Vitamin K helps to regulate the process of blood coagulation by assisting in the conversion of certain coagulation factors into their major forms. Without vitamin K, our bodies will be unable to control clot formation and prevent from excessive bleeding.
Mechanism of action, vitamin K and blood clotting. There are two activation pathways for coagulation. The intrinsic pathway, which involves only factor within blood vessel, is thought to serve as a positive feedback loop amplifying coagulation. The extrinsic pathway starts with the exposure of blood clotting factor to the tissue factor in the extravascular tissue. Two pathways convert into a common pathway producing thrombin and ultimately fibrin. Thrombin has the central role in the coagulation cascade. Thrombin cleaves soluble fibrinogen to generate insoluble fibrin.
Based on recommended nutrient intakes RNI for Malaysia 2017, the recommended intake of vitamin K is 65 and 55 microgram per day for adult men and women respectively. Meanwhile, for infants with age between 0 to 5 months, it is recommended to take 5 micrograms per day, and for infants between 6 to 11 months, the recommendation is 10 micrograms per day. For children between 1 to 3 years old, it is recommended to take 15 micrograms per day. 20 and 25 micrograms per day is recommended for children between 4 to 6 years old and between 7 to 9 years old respectively. Lastly, for adolescents with age between 10 to 18 years old, it is recommended to take 35 to 55 micrograms per day.
Let's move on to vitamin K insufficiency. First, low vitamin K levels raise the risk of cardiovascular disease. Additionally, it can raise the risk of osteoporosis and open bleeding. Finally, it will result in inadequate bone growth. Due to the high vitamin K contained in green vegetables and the capacity of the usual gut flora to produce menaquinone, vitamin K deficiencies are now uncommon in healthy adults. However, its deficiency can cause malabsorptions, a condition characterized by any illness that alters the gut flora. Next, newborns with an undeveloped liver, sterile gut flora, and low-quality breast milk are more likely to be deficient in vitamin K.